My name is Katherine Kramer, and today, for my special population project, I'll be focusing on Native Americans, specifically American Indians and Alaska Natives with diabetes. Did you know that Native Americans have a greater chance of having diabetes than any other racial group in the United States? And that diabetes is the leading cause of kidney failure, a costly condition that requires dialysis or a kidney transplant for survival. Using the vulnerability framework from our textbook, I will outline the predisposing and enabling factors that led to Native Americans being especially vulnerable to diabetes. Then, I will move into access to care and quality of care before touching on the health outcomes pre and post government intervention. Obviously, their race is the most prominent of their predisposing characteristics. Not only is their ethnicity rare, consisting of less than 2% of the U.S. population, but there is some evidence to suggest that they have a genetic predisposition for diabetes. Because their insulin is insufficient, it could be a contributing factor. Other predisposing characteristics include their geographical location. Most Native Americans live in rural areas on their reservations, where adequate medical services are hard to obtain. Also, Native Americans are approximately twice as likely to be poor and unemployed than average Americans, leaving them uninsured, an enabling characteristic. All of these factors together led to a vulnerability and a special population. With significant barriers to health care, it became an epidemic that quickly spiraled out of control. Health outcomes were poor, access to care and quality of care were low, and there was little education within the Native American community on how to improve diabetes. The problem needed more attention and more funding. To address this issue, the United States government created the IHS, or the Indian Health Services. The Indian Health Services serves the members of over 560 tribes and uses population health and team-based approaches to diabetes management. Health outcomes for Native Americans with diabetes improved dramatically after the implementation of the IHS. Diabetes-related kidney failure among Native Americans decreased by 54% from 1996 to 2013 with IHS oversight. These are important interventions because kidney failure is one of the most debilitating and expensive complications of diabetes. The average cost for kidney failure was over $80,000 a year, and Medicare spent over $10 billion treating people for it in 2013 alone. By serving these populations, the IHS was able to assess long-term outcomes and address disparities among Native Americans. They promoted wellness within the entire community and connected people to local resources like healthy food options, transportation, housing, and healthcare. The development of a team-based approach to diabetes care is what made the IHS so successful. Team-based care that included patient education, nutritionists, diabetes educators, pharmacists, and other community healthcare workers were able to integrate prevention and education. Now, they can screen people routinely and address problems before they start. A good model for diabetes care will include public health and population management. Assessing communities for access to healthy food and places to exercise is important, and local governments should work with the IHS to fund these ideas and make improvements to current housing situations. Also, care managers funded by the IHS should use the data to identify people who need healthcare services. Together, communities and government can stop the diabetes epidemic among Native Americans and reduce this special population. With this new information I have presented, I now have two discussion questions for you. First, what other interventions could be used to improve common health problems in Native Americans, such as alcoholism and mental health, with the same success that diabetes intervention had? Also, how could the expansion of the Affordable Care Act and Medicaid help Native Americans that struggle to get access to health care? Thank you for listening.